Continuing coverage this evening on the Medicaid pharmacy carve-out proposal in New York. WENY's New York Capitol correspondent Elise Klein spoke with advocates and lawmakers about what the issue looks like in the legislature. She's live tonight from Albany. Elise.
Renata, this is one of many contentious issues in the legislature. And some lawmakers feel the pharmacy carve-out should be repealed altogether, while others say this could help with issues of transparency among pharmacy benefit managers. Today, advocates traveled to Albany, urging the governor and legislators to stop the carve-out of pharmacy benefits from NYRx, a Medicaid program.
It's a complete decimation of the healthcare system, a gutting of the healthcare system as it exists today in New York State. Lots of people will be affected, numerous programs.
The carve-out will essentially transition enrolled Medicaid members from Medicaid managed care plans to fee-for-service programs, which some lawmakers say is having an inadvertent impact on the revenue streams for 340B, a federal Medicaid program that allows safety net providers to get reimbursement for the prescription drugs they purchase. Some advocates are worried this transition will negatively impact the safety net providers who give care to residents regardless of their ability to pay and ultimately have negative health impacts on New Yorkers.
You can't just play with people's health care. There are people with HIV that now will be able to spread, those things are in place for a certain reason.
The carve-out originating in the legislature's 2020 state budget delayed implementation for 2 years, which expires on April 1st. About 2 weeks ago, Senator Gustavo Rivera sponsored a bill introduced in the legislature to repeal the pharmacy carve-out. This bill is still in committee. Some lawmakers say the pharmacy carve-out is a complex issue, but this transition could ultimately help establish greater transparency from pharmacy benefit managers, or PBMs.
For the last decade, PBMs and health plans to a degree have been able to operate using billions and billions of taxpayers' dollars without any accountability when it comes to the prescription drug benefit.
Again, the Senate bill to repeal the pharmacy carve-out is still in committee, but ultimately any funding or policy changes to the Medicaid program will have to go through the final budget, which is due on April 1st. For WENY News, I'm Elise Klein. Back to you, Renata.